When it comes to children with autism, the most common trauma response is shutdown response. They would shut down, they would withdraw themselves even further because there is an overlap between certain core symptoms of autism and trauma. That is why probably it is not noticed or identified as a separate condition. People with autism perceive threat differently. Their level of accuracy at perceiving threat is lower than someone who is not in the neurodivergent spectrum. Connectedness is a problem when it comes to individuals with autism. How do you explain so much of rise in the prevalence of autism in the last 50 years? Because if you see it from the perspective of evolutionary biology, gene pool doesn't change so fast.
Trauma in autism. Is it missed, ignored, misunderstood, or we as a system, we as a society, we are not equipped to understand and handle it properly? Hello everyone. Welcome to India Autism Center podcast. I'm your host Pooja Datta, and today to guide us through this very important and crucial topic, we are joined by Ms. Anvesha Bhattacharya. She is a clinical psychologist with over 13 years of experience. She holds an MPhil in clinical psychology from RINPAS and an MSc in applied psychology from University of Calcutta. Her work spans from child psychology, psychotherapy, CBT, and mental health interventions. And today, she brings both clinical depth and real-world insights into this crucial conversation. Welcome, Ms. Anvesha.
Thank you.
Welcome to the podcast. How are you?
I'm fine. How are you doing?
I'm good. Let me start with a very fundamental yet a very important topic. Are we misunderstanding or underestimating trauma in autism? Or is it because the typical PTSD symptoms or post-traumatic stress disorder symptoms are not that evident in autism?
I guess we are misunderstanding the presence of trauma and how trauma could affect autism, and also probably the other way around. I think to discuss this, maybe we can see it from two aspects. A, how can trauma induce symptoms which could look like autism, which is known as trauma-induced autism at times, and also whether there, as you mentioned, because there is an overlap between certain core symptoms of autism and trauma, that is why probably it is not noticed or identified as a separate condition. I think both these things are there. For instance, let's say someone having autism cannot only be the result of genetic loading, right? That maybe I am genetically more vulnerable to developing autism. But at the same time, if I have been through childhood adversities, I've been through a lot of trauma in my early childhood years, that could exacerbate my symptoms of autism. So often trauma can act as a perpetuating factor, that whatever issues that I already have pre-existing because of autism, let's say my problem with social communication, my problem in relating to other people, my tendency to shut down or have meltdowns, all of this can perpetuate because of exposure to trauma. That can happen. At the same time, people with autism, they display certain symptoms which somewhat could be symptoms of PTSD as well. For instance, in high functioning autism, it's very common for the individual to be hypervigilant, right? Being hypervigilant, hyper focusing on certain things, then probably socially getting disconnected or having problems with interpersonal relationships, social withdrawal, which very much can be an effect of trauma as well. Right? So you are right to point this out, that maybe it is misunderstood, or sometimes even we fail to identify those as symptoms of trauma, and they're often overlooked as very normal and usual part of autism. I would say it's misunderstood.
Yeah, so to further elaborate for the viewers,
Right.
can you please easily differentiate between post-traumatic stress disorder and
Yes.
trauma?
Right, right. Firstly, I would like to clarify that PTSD is only one manifestation of trauma, right? Maybe it is the most talked about manifestation of trauma, but that is not the only outcome or manifestation of trauma, right? So, as you pointed out, in high functioning autism as well, we see re-experiencing and hypervigilance, right? Even if you see children with high functioning autism, they have a tendency of acting out or re-experiencing an event over and over again, which we find in PTSD as well. But how do we differentiate between the two? One could be from the perspective of sensory overwhelm or sensory overload. So let's say a person with autism but devoid of PTSD. In that person, we could see features of meltdown or a feeling of overwhelm because of sensory overload. That the person has been exposed to very loud noise or very bright light, and because of the sensory overwhelm, the person is having a meltdown. On the contrary to that, if it is a repercussion or a consequence of PTSD, the person will be triggered by something which is a reminder of past traumatic experience, right? So that is how probably it will be easier to figure out that this is an outcome of trauma. This could be interpreted as a symptom of PTSD, whereas this is a part and parcel of autism.
Okay, it is really overlapping.
Yes,
And
yes,
difficult to understand.
right.
So where do we draw the fine line
Hmm.
between trauma
Hmm.
and traits of autism?
Right. So another thing that could be important to differentiate is the onset. Like in autism, we see that the developmental milestones are not met after a point, right? That at a point of time, the level of social development or the level of development in communication, which is expected, or even eye to eye contact, the things which are expected from a child, those are not happening, then that's autism. But if, let's say, the person was having normal features of development, but it is after a traumatic experience that there is a sudden regression in the person's skills and level of development, that could rather be a sign of trauma. That my social communication was more or less okay, or I was interacting with other people, I was quite, how do I put it, expressive in my emotional expressions. But all of a sudden, there is a regression, and you can point out that there's been an onset of a traumatic experience after which this regression has happened. Right. Earlier, there used to be these concepts of certain which are obsolete now. We don't talk, like, it's not a separate condition anymore. But earlier, we used to talk about these categories of autism, like Rett syndrome, in which they used to say that there's normal development till 1.5, like 16 to 18 months of age. And then all of a sudden, there's a regression. Right. But it's not a separate condition anymore. It's so rare that it's been removed from all diagnostic guidelines. So this is another aspect, that onset of the condition, whether the onset is preceded by some traumatic experience, or it is just a part of the developmental milestones which are going astray after a point when it comes to these particular areas of development. And there's a regression in the developmental milestones which is preceded by traumatic experience, then it's a clear sign that it's an effect of trauma, or rather probably there are some trauma induced signs of autism rather than autism per se.
So even in an autistic individual,
Right.
how to draw that fine line? Because we know autistic individuals, they process informations differently at times.
Yes.
That is manifested in behavior,
Yes.
much like traumatic behavior at times. And how do the parents understand that this is again a traumatic response?
So yes, it could be tricky. It could be tricky in comparison to someone who is not in the neurodivergent spectrum, because as you pointed out, they may not be as expressive as any other child, and often that is misinterpreted as lack of distress that maybe it hasn't caused that level of distress. We see it in practice as well, because they have a flattening of affect, right? Like they don't have the kind of facial expressions. Like a child who is not neurodivergent, that child could be very expressive when they are distressed or when they are really overwhelmed in terms of their facial expression. But there could be a very flattened affect when it is an individual with autism. So you are right to point this out, that it could be difficult to point the differences. One, as I mentioned earlier, like there will be a difference between a typical meltdown and a trauma response. So typical meltdown will be in response to things that the parents can probably already identify, that these are things which cause sensory overload to my child. That when my child is exposed to these bright lights or bright colors or very loud noises, my child tends to have a meltdown. So I know this is a meltdown. But when I see that the child is probably getting triggered by something which is a reminder of a past traumatic experience, I'm aware of that, then I know that this is not a meltdown, this is a trauma response. And when it comes to children with autism, the most common trauma response is shutdown response, like freeze response or shutdown response. They would shut down, they would, like withdraw themselves even further. They probably may not talk with anyone. They might, rock in one place, these sort of repetitive movement or gestures in trying to soothe themselves, in trying to ground themselves. They may become even more rigid, not to move out of places which they consider as safe or they consider secure. So then probably the parent will be able to figure out that this is a clear sign that the child has probably been traumatized by something, rather than this being an usual meltdown.
Before we move on to the next question, please have a look at who we are at India Autism Center.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Coming back to the podcast, so that was really very insightful, because we know that at times there are overlapping symptoms between autism and traumatic experience. Not only that, but there are so many other overlapping factors as well.
True.
So on the same line, two autistic brains, they process the threat differently, or is it because the environment that becomes more threatening for them?
The environment could be threatening for them. We can't deny the fact that the environment is not very neurodivergent affirming, right? The kind of environment we provide them in general. Of course, India Autism Center provides autism affirming environment, but that's not the kind of environment they're exposed to in general. So that is there. That is, of course, something which is undeniable. But it is also undeniable that people with autism perceive threat differently. In fact, they might have a disadvantage at perceiving threat. What I mean to say is, like research shows that their level of accuracy at perceiving threat is lower than someone who is not in the neurodivergent spectrum. Because just like their own facial cues, they might have difficulty understanding facial cues of other individuals as well, right? So at times when someone is angry, they may not perceive it as anger. So there could be a level of inaccuracy in how they perceive cues of threat, and hence there is a difference in the perception of threat, and that could make them more vulnerable to threatening conditions. So that is of course there. And also we have to ensure we have more autism affirming, peer friendly environment, which is not there at present in general. So of course that is a factor as well.
Based on your experience, you have done so much work on trauma. Uh, can you share some experiences of autistic individuals with traumatic experiences and how they have been through this phase?
You know what? I have seen something, and this is something that very recent research is also aligning with. You know what's interesting? It's almost on a cosmic level that connectedness is a problem when it comes to individuals with autism, and that is in all aspects. It's as deep as neurobiological, social, environmental. What I mean to say is, current research is saying that people with autism have lesser synaptic connections than other individuals. So that's neurobiological, right? But also, as you were mentioning right at the beginning of today's podcast, that is it also systemic? So that's also true. It is also systemic, because if you notice, we say this, right, that it takes a village to raise a child. So where is the attachment village now? Right? Earlier, there would be two sets of grandparents, friendly, safe, good neighbors, your own family. So there actually was a village. Now there's no attachment village. So there's lesser social connectedness for every child, for that matter. Because what I often sit back and wonder, how do you explain so much of rise in the prevalence of autism in the last 50 years? Because if you see it from the perspective of evolutionary biology, gene pool doesn't change so fast, right? Like mutation or the change in a gene pool takes hundreds of years. Then why is it that there is so much of rise in autism in the last few decades? So the only thing which has changed drastically is our social structure, right? Family functioning is getting disintegrated with every generation. We do not have a village to look after a child anymore, right? Also, there are these sort of trauma specialists like Dr. Gabor Mate, who are pointing out that conditions of neurodivergence like autism and ADHD, of course, they have a genetic contribution to it, but with that, there probably could be a contribution of attachment trauma as well. That it could perpetuate the condition. No one is claiming that attachment trauma could lead to autism, but attachment trauma can perpetuate symptoms of autism in an individual. It can act as a perpetuating factor. So this is something that I have seen, this is something that I have noticed in my practice as well, that sometimes maybe a child who probably had autism already, but the symptoms have been perpetuated by some sort of trauma that probably the child was unable to process, or probably was so young that did not have the proper resources to cope with it. So that is something that I have seen in my practical experience as well.
So can you please let us know this attachment trauma that you said? Can you please explain what is it?
Sure. So basically, we all know about the theory of attachment, but of course, we have to explain that for our audience, that the first primary caregiver that you have during the first 18 months of your life, that is the sort of attachment type that you form. And then it keeps repeating itself in every other relationship that you form in the latter years of your life, right? But during that sensitive period, during those first 1.5 to couple of years, if there is a sudden separation with any of the parental figures or caregivers, there is a sudden loss, separation or rupture in that relationship, that can cause attachment trauma, right? And it could be very basic. For instance, these days, even doctors propagate this knowledge that the child should have skin to skin touch with
Yes.
both the parents right after they are born, not only the mother, right? Because more and more research is pointing out that probably we underestimate the importance of the attachment with the father figure as well. So those sort of things. For instance, there's this concept of co-regulation. For instance, when we were talking about threat and how trauma could be different in autism, another problem is that people with autism have higher levels of emotional dysregulation. So emotional regulation is a challenge that they face, right? So that could also be a contribution of lack of co-regulation. So co-regulation is when the child is learning how to regulate their emotions, co-processing it with the mother right from childhood, with small things, how the mother soothes the child, how the mother holds the child with one hand on the head and rocks the child very soothingly, very lightly. So even these small things have been proven to affect normal brain development, and also development of these skills like emotional regulation. So if that goes missing, then of course that could lead to symptoms of autism.
Can these repeated small stressors like routine changes, sensory overload, or social struggles, even it can build up into trauma over time?
It could. It could and it could not. Both the aspects are there. But yes, when it comes to people with autism, maybe there are higher chances of this leading to a piled up situation of chronic stress or trauma. That can happen because, as we were discussing, because people with autism, their brains are differently wired. So there is a level of cognitive inflexibility, tendency to ruminate over things, not being able to let go. These challenges are there with when it comes to people with autism. So that's why it becomes a bit difficult to build a level of resilience or, in today's language, post-traumatic growth. Now, resilience and post-traumatic growth, these terms are used interchangeably. So because these challenges are there with people with autism, building resilience is comparatively difficult. So that's one aspect. Also, because we were discussing about emotional dysregulation as well, when it comes to the trauma informed approach, we have this concept of window of tolerance, that we all have a window of tolerance. Whenever something happens which is within our window of tolerance, we are able to deal with it. But if it makes us feel that this is beyond our coping resources, we can go to a state of underwhelm or overwhelm, which is above or below the window of tolerance. So, from that perspective, also, we might be able to say that when it comes to people with autism, because of their difficulties with sensory processing, which can even get aggravated on repeated trauma, maybe their window of tolerance is really shrunk, or the threshold of tolerance is quite low. So, maybe anything which is not that stressful for someone else could be perceived as stressful or overwhelming by someone with autism as well. So, yes, then that could lead to an exacerbated state, which would reflect as more difficulties in sensory processing, more frequent meltdowns, perpetuation of the already existing symptoms. So, yes, that can happen.
When individuals are having this traumatic experiences who are in the spectrum, how can the children, they rebuild their trust after this traumatic experience, and can overprotection, even when it is safeguarded, even when it is well intentioned from parents and authority figures, can that also lead to the resolution of trauma?
Overprotection could be a double-edged sword. Of course, the concern of the parents is not misplaced. As we were discussing, the environment is not really autism friendly, right? So they will be concerned. They will want to protect their children as much as possible. But protection can also mean lack of exposure, right?
Mm.
So if you are not exposed to a lot of situations, how do you build resilience? How do you develop your coping skills? So that is also there. So there should be a level of balance. Like, you will of course feel like protecting your child, but situations where you know that you have your eye on your child, or the child is not completely on their own, maybe you can expose them gradually as well. Gradual exposure is something which probably is more friendly to build on their skills, and also just like any other child, like it doesn't only have to be children with neurodivergence. Mental preparation helps, right? Any child who, let's say, has anxiety, what do you do with that child? You prepared the child from before that we are going to go to this place. I know you have social anxiety. That is why I'm letting you know in advance. There are going to be this many people. There could be this many children of your age. Maybe you can do this. What can help you be calm in that situation? Let us prepare. Let us make a self soothing kit. Maybe you can carry it along, in any situation where you feel anxious, in any situation where you could feel overwhelmed. So, these could be certain ways. Firstly, talk with your child. Ask the child what has happened. Usually, people with autism do not mind questions. They ask a lot of questions. They don't mind if you ask questions as well, right? So, you can ask them questions. You can be open to them asking you as many questions as they want, for better clarity, for better transparency, for them to be able to process whatever has happened. Prepare them beforehand, give them as many resources as possible, gradually expose them to the situation, you know. So I think these things could help for them to rebuild their trust.
So is it that parents often they say he will not understand, even for children, the death of grandparents or any death, misery, loss.
Yes.
So they will not understand, or they start giving them some jargons. This happened because of this. Out of overprotectiveness, safeguarding the child, how will he process that?
Right.
So what is your take, on this for parents who are watching this?
I think we grossly underestimate children.
Mhm. Even who are in the spectrum.
Or not, like I think the neurodivergent children, especially children with autism, could be the kindest, could be the kindest. They don't find fun in ridiculing anyone, right? They don't find fun in pulling anyone else's leg. They don't find fun in intimidating anyone or making anyone else feel small, right? So they are far kinder than, I would say, people who are not neurodivergent or not in the spectrum. And as I mentioned, these things usually don't help, because children, irrespective of whether they are a part of the spectrum or not, they are very intuitive. They might process things differently from us, but that doesn't mean they don't understand things. Also, children in the spectrum are observant of a lot of cues because they're hypervigilant. They observe subtle differences in their environment. So, you cannot hide something like death, or you cannot sugarcoat it as well. So, it makes far more sense to communicate it to the child in as much a soft, calm way as possible, asking as many questions as they want and letting them ask as many questions as they want. That will make things far easier for them, rather than that ambiguity and that vagueness and understanding that I'm being told some things, I'm not being told some things. That never helps for any child.
True. Can trauma be fully resolved in autistic individuals? The therapies that we give, the trauma-informed therapies that we give, are these equally efficacious, or it needs customization? Your take on it?
Yeah. Firstly, again, something that I would like to clarify in general, healing from trauma is always an ongoing process, for anyone, like irrespective of whether they are a part of the spectrum or not. Anyone, even on their dying day, wouldn't say that I have completely gotten over it, but yes, it doesn't bother me anymore, it doesn't affect me anymore, I have made peace with it. That of course can happen. Now, when it comes to people who are in the spectrum, you are right to point this out, that the intervention modules which are out there, those need to be heavily modified. and customized. You cannot just use them as it is when it comes to children with autism. We, of course, have to modify it. Also, another aspect of challenge is even the assessment tools, right? So, for example, uh, if we assume that children with autism usually have certain features which could be misunderstood as PTSD and vice versa, in that case, there should be different cutoffs or thresholds for it also, or different assessments, especially for people in the autism spectrum to assess PTSD. So these assessment tools are also just recently coming out. It's in 2022, 2023 that certain individuals are coming out with these sort of scales which can help in assessing trauma, particularly when it comes to adults or children with autism. So that is something that probably we should educate ourselves with. That is one part. And when it comes to therapy, trauma focused CBT or mindfulness approaches, these could be used in people with autism, but it has to be modified. It has to be customized to the unique needs of that particular individual.
So, have you come across any child or any individual on whom the customized therapy has worked in trauma management?
Yes. You know, also, it's so underdiagnosed, right? Like now, people who are in their late 20s or early 30s, when they come to us, now probably, you know, we can backtrack and understand that, okay, this person is in the spectrum. You know, they have been misunderstood all their lives. They never understood why some things are so challenging for them, whereas it is not challenging for others. Or something that they have said very normally has been perceived as very audacious or very arrogant, because, you know, they don't understand these cues. So, you know, a lot of times even this has happened that I don't know that the person has autism, the person doesn't know that the person has autism, and it is through therapy that we have discovered that, okay, the person is in the spectrum. And then probably we had to customize certain things, especially the areas pertaining to interpersonal relationship, interpersonal communication, how to process interpersonal cues, you know, clarifying certain things from beforehand, knowing themselves better, that, okay, this is something I have difficulty with. And yes, it has worked. I think always the first step is awareness.
Yes.
Right. The more you know, the more you can clarify that, communicate that, and it makes a lot of things easier.
So, just out of curiosity, these individuals who are understanding that they have autism at such a later phase of their life, how do they feel usually? What's their experience that they share with you after the diagnosis?
Right. You know, I think a lot of them experience a sense of relief.
That finally I got
Thank
to
God.
know.
I know that this is not because there is something inherently wrong with me. Because all their lives they have been misunderstood, right? Or they have been criticized in a way, or cornered in a way, that why can't you do this? This is so normal. This can be so easily done by
And there is no
anyone
answer
else.
to it.
Right? And they have always felt that maybe I'm built this way. You know, maybe there's something wrong in my quote unquote default setting. That is how they have processed all these years. Now they know, you know, that, okay, this is because of something which essentially has wired my brain differently. I function differently as a person. I'm just different, you know. So I think in most cases it's been helpful. And it has, you know, like it's been an eye opener to them that, okay, this is why interpersonal communications, I see this pattern. This is why my friends think I'm this way, you know. So usually it comes with a sense of relief. It lifts off a weight of self criticism from over them, and that's helpful, I would say. Yeah.
Thank you, Anvesha, for such a meaningful discussion. I hope this is really insightful for the parents. Before leaving you, any suggestions, any piece of, advice or expression for parents whose children are in the spectrum, or for the individuals as well?
Firstly, you know, like now we know it's a spectrum. So all of us could be there somewhere. Maybe we are not at that end of the axis, but we are there somewhere. So, firstly, not seeing them as very different from us, but people who differ from us in certain aspects in terms of severity or intensity. That maybe they sense certain things more than we do. Maybe certain things affect them or influence them more than we do. But also, there are aspects in which they are far better human beings, I would say, than we are. Right. So, we have to give that proper acknowledgement as well. So they are different, but they are not, how do I put it, any more crippled than we are. So, maybe seeing it like that, like making them different doesn't make them any inferior than us. Maybe that could be helpful for the person as well as their families. So that's there. And also, as I mentioned, don't see them as a different breed altogether. They are very similar to us also in a lot of ways. So treat them like you would treat any other child, but maybe with a bit more understanding and kindness.
Yeah, and
That could go a long way.
one thing that you said, it really touched me. That is, they process differently, but it's not that they do not understand. They
Absolutely.
understand things.
Hmm.
To the audience out there, if you feel this video is insightful, please do not forget to subscribe to our video channel and like, and also share this video as much as possible. Thank you. Until we come with next such insightful video, please have a look at the video that is popping up onto your screen.